Welcome. In this video, we will explain spirometry in a simple and easy way. It is one of the most common lung function tests used around the world. It helps doctors understand how well your lungs are working and whether there is an obstruction or restriction affecting the breathing. The test is quick, painless, and non-invasive. It is commonly used in patients with asthma, chronic obstructive pulmonary disease, chronic cough, shortness of breath, and many other respiratory conditions. By the end of this video, you will understand what spirometry is, how it is performed, what measurements it provides, and what diseases it can help diagnose. So let us begin. It is a breathing test that measures the amount of air you can inhale and exhale, and how quickly you can blow the air out of your lungs. Think of it as a fitness test for your lungs. Just an ECG checks the heart, spirometry checks the lung function. During the test, you breathe into a device called spirometer. The machine records different measurements and creates a graph that doctors use to evaluate respiratory health. It is useful for diagnosing diseases, assessing their severity, and monitoring response to the treatment over time. Doctors often order spirometry if a patient experiences symptoms like wheezing, chronic cough, chest tightness, or shortness of breath. It is also used before surgeries and in people exposed to smoking or occupational dust. The procedure is very simple and usually takes only a few minutes. First, the patient sits comfortably and a nose clip may be applied to prevent air leakage through the nose. Next, the patient takes the deep breath possible, filling the lungs completely. Then, a mouthpiece connected to the spirometer is placed firmly between the lips. The patient blows out as hard and as fast as possible until no more air remains in the lungs. And this forceful exhalation is extremely important because accurate results depend on patient effort. Usually, the test is repeated at least 3 times to ensure consistency and reliability. Sometimes, the test is repeated after giving a bronchodilator medication. Comparing the results before and after medication helps doctor determine whether airway obstruction is reversible, which is commonly seen in asthma. Spirometry provides several important measurements. The first is FVC or forced vital capacity. This represents the total amount of air that can be exhaled after taking a deep breath. The second measurement is FEV1, which stands for forced expiratory volume in 1 second. It tells us how much air can be blown out during the first second of forced exhalation. Another important value is the FEV1 divided by FVC ratio. This ratio helps identify the airway obstruction. In healthy individuals, the FEV1 to FVC ratio is usually above 70%. A reduced ratio suggests obstructive lung disease like asthma or COPD. These values are plotted on graphs and compared with predicted normal values based on age, sex, height, and ethnicity. And this comparison helps physicians determine whether lung function is normal or impaired. Spirometry plays a very important role in diagnosing and monitoring many respiratory conditions. It helps identify asthma, where airway narrowing is usually reversible with medication. It is also essential for diagnosing COPD, a progressive disease commonly associated with smoking. And spirometry can detect restrictive lung diseases like pulmonary fibrosis, where the lungs cannot expand normally. Doctors use it to monitor treatment response and disease progression over time. In summary, spirometry is a quick, safe, and highly valuable test that provides important information about lung health. Early detection of respiratory diseases can lead to timely treatment and better outcomes. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more easy to understand medical videos. Thank you.